What's one thing that you think you could talk about for hours?
The need for mental health opportunities and resources for students, elderly, pediatrics, everything. Just what we can do to advocate for mental health and get rid of that stigma. My name is Lara Zwilling. I'm an instructional assistant professor in public health and health professions, and my department is clinical and health psychology.
What song always boosts your mood?
Oh, that's so hard. I would maybe say The Weeknd, Blinding Lights. I know it's super popular, but it just gets me ready. And I like to run and walk to it, so.
If you could eat one thing for the rest of your life, what would that be?
Probably crab legs.
How do you like them?
Actually, they could be cold or hot as long as I have butter to dip them in.
And what's your favorite TV show?
Oh, that's another hard one. I'd probably just go with a classic like Seinfeld.
So you're a licensed mental health counselor, and you're also a certified forensic mental health evaluator. Why did you initially choose this career path?
I had a little bit of a rocky start as a teenager, and I was surrounded by social workers and mental health professionals that really helped me out a lot. But like developmentally, kind of 18 to 24, you're really struggling, I think, a lot of times with what you want to do, not just occupationally, but personally and spiritually and everything. And they just grounded me. They made me feel valued and respected and important. I said, I want to do that with other people. I want to make sure that they have the same feeling as me and just feel that respect and really motivation, right, to go forward with life.
What's one of the best phrases or sentences that you encourage your students to use as a form of therapeutic communication?
I got this from an old buddy of mine, a lieutenant. Those who cause the most pain are experiencing the most pain. Helps you with empathy.
What's your favorite lesson to teach in your therapeutic communications class?
Gosh, there's so many. And I feel like I have experience in all of the areas that we teach, like substance abuse, mental health, death and dying. Probably it'll come down to verbal and nonverbal communications. I really like teaching about connecting and also de-escalation with others. There are so many techniques and tools that students can utilize from those two lectures, verbal and nonverbal communications, that will go forward through whatever environment they're working with, and they can utilize those for their benefit and for the patient's benefit.
While you've been a practicing mental health counselor, were there any things that you've tried with de-escalation and with crisis communications that you were able to share with students? Like any examples from your work?
Absolutely, yes. I know this sounds cliche, but active listening is the best de-escalator. Not a lot of us actively listen to people. What we do is we listen, but there are a lot of other thoughts going on in our mind about, is my cell phone buzzing? What is my grocery list at Publix? But when we're genuinely there and present and actively listening to another party, that's the biggest de-escalator you have.
So I read that you like to work with students who are in more challenging situations.
Yes.
For working with students who are first generation, so they're new to college, and this is, something, it's a whole new experience for them.
Absolutely.
What do you usually tell students who are going through tough times?
In the past, that's kind of what my specialty has been. I've worked with more high-risk students, and it depends on the student, right? I certainly couldn't give a script. A lot of times when there doesn't seem to be a way out, we see that people experience a lot of rigid thinking, a lot of black and white, all or nothing thinking. And when we pull back the layers and we talk about, well, this might have happened before. Can you and I somehow build a plan that incorporates what you've done in the past to survive and cope, and then new innovative things that we can talk through in this session right now? And let's build a plan, because I know that you think that every day for the last 6 months has been overwhelmingly horrible. But if we look back, there are some times that the sun broke through, and let's evaluate that, let's explore that a little more, and specifically for you, let's create that plan.
What's one piece of advice that you have for your students, if you could pick one thing?
Remember the why. We talked a little bit about burnout, and there's this psychologist from Duke that explains burnout as the inability to experience positive emotions. And I always talk to my students about the reason you're getting into healthcare. Hopefully it's not salary or title, but if it is, that could be a part of it. But remembering the why, I would tell them to take care of themselves. I would tell them to remember what I talked about with burnout and what that looks like, and how there are easy interventions. When you are able to change the trajectory of a human being's life through your knowledge, skills, and abilities in healthcare, and then they leave the room and you don't feel anything, that's burnout. And we need to recognize that and take care of yourself, and in turn, you take care of your patients that way.
Awesome. That was pretty much all the questions.
Really? Oh my gosh, I've been so nervous.
Do you have anything else that you want to add?
It's an honor to be able to work with undergraduate students that are considering direct patient care, because what an occupation, right? Working with people who are vulnerable and need, and I want them to be able to walk out the door saying, because I was there, I made a difference in this patient's life. So.
Teen spray.